Patient will fill out their paperwork, the consent form for them to be able to do the procedure. When you get ready to do the hookup, you're going to have the patient stand in front of the chair so that you can apply some wires while they're standing up. The first wires that you would apply would be the leg wires, because you want to make sure that the length of the wires allows them to be able to stretch out while they're sleeping, so they don't pull your wires or break your leg wires when they stretch out while they're asleep. The abdominal belt is placed over the wires and over their shirt to record the diaphragm. The respiratory belts allow you to record the respiratory effort of them trying to breathe. That will help you distinguish between your obstructive sleep apnea and your central sleep apnea. The rib belt that is placed across the chest also has the body sensor on it, position sensor. That will let you know if they're sleeping in the supine position on their right side or their left side. You want to apply your gloves to protect you from the patient and the patient from yourself. The snore mic is applied just to the side of the Adam's apple to record the patient snoring. The measurement of the head, the first measurement from the nasion to the inion, and if that measurement is 36 centimeters, you want to mark up 10% from the inion at 3.6, the 50% mark at 18, and from CZ to FZ would be 20%, which would be 7.2. The next measurement from the preauricular crease to the preauricular crease, that measurement is 38. You mark the 50% mark, which would be 19. And then you do a measurement to the left side at 7.6, which would be 20%. And then you do 20% on the other side, which would be 7.6. The marks also mark your sites for your chin, your EKG, your eyes. You mark 1 centimeter out from the canthus and 1 centimeter down. Ground goes there at FPZ. You're going to prep those sites to be able to apply your electrodes. When you're prepping your site, that's just to abrade the first layer of skin, remove any excess oils from the skin. You want to prep your electrodes equally so that your impedances are equal on all of your electrode sites. F3, applying the F3 electrode or prepping for it. Your C3 prep. The snap-on leads are used for the eyes. And those will record things such as REM sleep for rapid eye movement. Your chin lead is applied for bruxism. The chin lead is applied to the inferior edge of the mandible and used for chin dropout during REM sleep. Your EKG pads will tell you your heart rhythms, whether you have a normal sinus rhythm or ectopic beats that can be noted during the sleep study. You also will be recording the EKG heart rate throughout the study. Want to be sure to plug your wires in to be able to record the respiratory effort. Once you have applied your wires, you want to wrap them with the posy to prevent your patient from getting tangled in the wires during the night. Paste will be applied to the gold cup electrode. And use tape to secure the ground at FPZ. And FPZ is in the center of the forehead. All of your electrodes are referenced to the ground, so you want to make sure your impedance is good for your ground and prevent it from coming off, you use that tape to secure it. F4 electrode is applied, and that will record your brain waves for sleep. That's your delta brain waves. C4 electrode is applied, and that will record your vertex waves, sleep spindles, the mastoid M2 electrode is applied, and that is your referential electrode. O2 electrode is applied to record your alpha activity, which will tell if you're awake. O1 electrode is applied to the other side as your backup to your O2, and also records the alpha activity. And your C3 electrode is applied to the other side as your backup for your C4. F3 electrode is applied as your backup to your F4. And your M1 is applied, which is again your referential electrode. Then grid 2 in your derivation. The EEG electrodes are kept separate than the other electrodes, so that when you take your wires off in the morning, you will be able to pull your electrodes, EEG electrodes, off. The thermistor is placed inside of the cannula, and the thermistor is what records the temperature change to record the breathing, airflow. Both of them are placed underneath the nose, in front of the mouth, to record the airflow, whether it's coming through the nose or the mouth, during the course of the night. Your cannula is plugged into your pressure transducer. And you put on a wire cover to make all your wires come into one ponytail. The leg leads are secured. And now the patient is ready to move to the bed. Use some tape to secure your airflow. And the pulse ox is applied to the patient's finger to record the oxygen saturation. Have the patient lie on his back with his eyes open to get ready to do the biocalibration movements.